Good afternoon, and thank you so much for joining our Race Today podcast, which is a 1-hour talk show about racism in the United States. I'm Dr. Alicia Williams, and I'm one of the co-producers for our Race Today podcast. And with me, I have two of my other co-producers, Sherelle.
Hi, my name is Sherelle Zicki. I'm one of the co-producers here for Race Today. I'm actually looking forward to this conversation as this is something that is really important both on the mental side and on the health side, how you balance both. So I'll pass over to my other co-producer, Lisa.
Hi, everybody. Thank you for joining us. I'm really looking forward to it. We all know how important health is going through COVID, both mental and physical health. I'm very interested myself in how this conversation will be today. Thank you.
Thank you, Sherelle, and thank you, Lisa. And as they alluded to, we will be talking about Black health today. Again, we have the opportunity to hear from a wonderful panel of health experts, and I want to ensure that we begin with brief introductions from each of them. And I will begin first with Dr. Clemmy Williams, if you can introduce yourselves.
I'm Dr. Clemmy Williams, board certified in family practice. I practiced medicine for a little over 20 years, and 15 of those were in the military. And I'd like to thank you all for inviting me to this podcast because it is very important. And especially thanks to my daughter, Alicia, who asked that I do this. So thank you.
Thank you, Dr. Williams. I will next hand it over to Dr. Vaughn.
Good afternoon. My name is Janet Vaughn. I am a lieutenant colonel who promotable in the U.S. Army. I serve as the Deputy Commander for Behavioral Health Services here at Womack Army Medical Center at Fort Bragg, North Carolina. And it's a pleasure to join everyone.
Thank you, Dr. Vaughn. Next, I have Jana Long.
Hello, everyone. I am really honored to be part of this esteemed panel. I am the Executive Director and co-founder of the Black Yoga Teachers Alliance, which is an organization that provides continuing education and professional development for Black yoga teachers. And I am a longtime practitioner of yoga. I celebrate 50 years as a practitioner this year, and it's wonderful to be here and be part of this discussion on Black health. Thank you.
Thank you, Jana. And last but not least, we have Dr. Lee.
About to speak before unmuting. Well, good afternoon. As stated by all other panelists, it is a great honor to be welcomed to this venue to talk about this important issue that is definitely having an impact in our communities across the nation and around the world as we move from pandemic to pandemic to endemic to pandemic. It's really causing a lot of stir. So I look forward to it.
Thank you to each of you for being with us here today. And with that, I will turn it over to C.R. Gibbs, our esteemed moderator. Thank you.
Good afternoon, everyone. Again, welcome. My first question is for Dr. Janet Vaughn. And I'd like to know that your feelings about the fact that the military has been marred with a high suicide rate. How has the suicide rate impacted your base?
Sure. So I would like to kind of clarify the conception that we have been marred. We are an industry, large business, as we all are aware of. So when you're a big business that support hundreds and thousands of people and their lives are in your hand, you're going to be always actively engaged in the news. We have a system in place in the Department of Defense to track the way we handle death, which includes suicide. So because of our capability to track and monitor deaths and the reasons why people expire, of course, our statistics are going to be pretty astonishing. But when we put it per capita, per 1,000 against our civilian communities, I would beg to argue that we're probably comparable, if not smaller, when it comes to the proportion of deaths and when it comes to completions of suicide. I just kind of want to set that stage, because in the civilian community, there's not necessarily a way to track all the way deaths are happening, nor is it mandatory to do that, where in Department of Defense it's mandatory to track and monitor the deaths and completions of suicide. And that's just for clarity. It has been a tremendous impact on Fort Bragg here in the way people have been completing suicides. Unfortunately, there hasn't been like one major trend that has set the standard of what we should look for, not a certain age group, not a certain rank. We have not been able to say is a one particular factor or a couple of particular factors. Every person's decision to complete suicide or make an attempt that ended in completion has been for their own various reasons, whether it's been relationships issues, work-related tension, maybe some severe mental health diagnosis and unable to manage it, or just the thought that this may be an actual solution for them in comparison of how they've been coping with life skills. So it's really been hard for us as an institution and as a installation to just say, how can we be more helpful and how can we be impactful in a way that's meaningful when you don't necessarily have a specific trend? So the goal for us as a department, as an installation, and as for leaders in the military, is to treat people with dignity and respect, to reach out to each person and ensure that we have connected with them in a humanistic manner, and also that we get to know people in a very sincere way. One of those ways is kind of coaching a little bit about being vulnerable, sharing with people, having real touch points, having leaders that do authentic engagement, not just checking a block and making sure people show up for formation or accountability, but that you're genuinely interested in others' lives. We also trying to communicate to stop those walking greetings, you know, when you say, hello, how are you doing? But you're still walking. You didn't actually stop and make eye contact. You didn't have an emotional connection. You really didn't provide a sincere moment. So we're asking all of our soldiers, but particularly leaders, to take the charge and the lead, to be authentic, to be empathic, and to also connect with people and understand that we're not the old Army where you suck it up. We have a generation of service members who are serving who wants to know the why, where I've been around forever. So you could tell me to show up at formation at 0500. I'm going to mumble and grumble, but I'll show up. You don't really have to say much to me. But someone who is, you know, significantly younger than me want to know, why do I have to be there at 5? Why do I have to show up? What's going on? What's happening? And a lot of that leads to being authentic and being vulnerable and sharing. A lot of things you can't share. We get that in the Army. But when you show that, we see that people care and that you care about our thoughts and the way we're thinking and the way we are processing. So connecting across all generations, closing in the gap, and also teaching our leaders that we show them the way. So they don't know how it's supposed to be unless we are showing them, and being very authentic in that process. So we have lots of prevention programs, which I won't rattle off. I think the most sincere thing that is important for all of us to show our service members is that we actually do care about them and that we will treat them with dignity and respect, and also help them manage hardships that they're experiencing in the military.
Thank you. Thank you very much, Dr. Vaughn. As a personal aside, that's great news to me. I did my basic training at Fort Bragg, and
Okay.
In those days, we had to suck it up. I mean,
Yes,
you could be
sir.
laying with your head separated from your body, and they say, go pick that head up and get back in formation. So I'm glad to know that some things have changed.
We're working on it.
Thank you so much. Dr. Williams, how are you, sir?
Fine, thank you.
All right. What are doctors taught about Black health in medical school?
Well, mostly we focus on the fact that there's such a shortage of Black physicians in this country, and it's because it's not focused on in families growing up, and the situation in the country is such that we've not spent a lot of finances to help the situation with Black physicians, such that there are really only two medical colleges. Harvard Medical College, which I went to, and Howard University in Washington, D.C., where you have 2/3 to 3/4 of the Black physicians graduating from in this country. And that's so unfortunate, but prayerfully the new HBCU initiative will certainly help that. And so mainly I think we need colleges and universities to focus more on Black physicians going into medicine in the various specialties. Although when I came along, most of us were interested in family practice, OB/GYN, internal medicine. And so there's such a great need. It's really only about maybe 40,000 or so Black physicians in the country now, and we really need probably 10 times that many.
Wonderful, wonderful. Thank you very much. Dr. Mark Lee, how are you, sir?
I am doing good, Mr. Gibbs. It's nice to see you again.
Hey, man, you stole my line, brother. I was getting ready to say the same thing to you. Listen, how do you see the influence of social media, for good or ill, on the identity of African Americans?
Well, social media has been around for a long time. And when you think of social media, realistically, it started further back than people really realize. When you think about the advent of the digital age coming into play from the 60s, and looking at how it shaped the views of the plight of African Americans and what was going on in terms of the legal system with the police and the government, and following through the civil rights era. And so it has had some positive impacts in that way. More recently, you do see a litany of concerns, both positive and negative, around social media, and that social media has in the more recent era, since 2014, I would say, has taken on a more positive tone in the Black community by highlighting a lot of social injustices that have been occurring in terms of police violence and brutality amongst those in our community. So you do see it having both positive and negative effects, but it's generational, I think, as well. Those of us who are in Generation X, and then you look at the millennials and then the Gen Zs that come behind that, they've had some negative influences because some of the bad characteristics within our communities have been exacerbated through social media as well. So with the proliferation of individuals being able to see various cultural themes play out, they're able to then go out and imitate those within their own communities from across the globe and around the country. And so we do see a great deal of it being positive in terms of bringing things to light. But even in bringing those positive attributes and allowing for individuals to get a platform to discuss the exigencies of racism, it's brought about a lot of anxiety and in terms of the mental health within the Black community also. Because when you highlight the violence that has been perpetrated against someone, there was one study I read recently, Dr. Williams, I forget I think his name is Clarence. No, it's not Clarence. Forget his first name, but he's Dr. Williams. He teaches at the Harvard Medical School. He had conducted a study back in 2018 that stated that individuals seeing an unarmed Black person being murdered in the media causes several months of anxiety increase in the community versus seeing a Black person who was armed being harmed. So the impacts that social media has can have some very serious mental health consequences overall, is what they've stated. So when you look at it, we do have to consider the impact, both negative and positive.
Thank you very much. Sister Jana Long, it seems like we're suffering from anxiety, so we're parking in front of you right now to get rid of our anxiety. And so, you know, how do you see yoga impacting African-American health and wellness?
You're on mute, Jana.
I knew I was going to do that. Thank you, CR. You know, there's been a seismic shift in the numbers of Black people participating in yoga practice since the 21st century. I remember when I first started teaching in the late 90s, not that long ago, it was very difficult to get African Americans to participate in yoga, mainly because of sometimes fundamentally held religious beliefs that yoga was a religion that was trying to convert you from what you believed in. That was a huge barrier. I think also some people thought it was a cult. I know when I first started practicing in the 1970s and through the 80s, I never told anybody about practicing yoga because they thought I was some kind of weirdo. And then even some folks, because when we are invited to look inward, to look at our own thoughts, for some reason, there are segments of our society that sees that as something demonic. I don't quite understand that, but those are some of the barriers. However, and especially even more acutely now since COVID has ripped away all of the inequities in our society, particularly around healthcare and health disparities, we're finding more and more people, Black people, African Americans, and I like to say Black because it includes everybody who is of African descent and not necessarily American. They are called to yoga. One, it gives us more agency and empowerment in our self-care. The first and primary step to healthcare is your self-care. How do you take care of yourself first? And then when you need medical attention or need to consult with a health professional, you come in as a more informed patient because you have been taking care of yourself. So there's an empowerment to it around our self-care. I was called to teach because living in Baltimore, predominantly African-American Black city in terms of the population, and despite there being this world-renowned medical research center, the Johns Hopkins complex, there were a lot of sick Black people here, primarily suffering from obesity, hypertension, diabetes, and a degree of arthritis. And all of these were conditions that the physical practice of yoga, and let me clarify something here very briefly. Yoga is a comprehensive system. It has a physical component, and that is what is commercialized and promoted in the United States. But that physical component is only one of eight of its limbs. And so that physical, what's called Hatha yoga practice, is an introduction. It invites us into our own bodies to open them up, to bring in some relief from some of the acute and chronic conditions that may impact us. And I think that's why we've seen quite the influx of more participation of Black people in yoga. Once we do that physical part, we also then recognize and realize that it has an impact on our mental state and our emotional state of being, because we are one single organism, so what you can't impact the body without impacting the mind, and the other way around. And so with so many health disparities that we're recognizing, the need to self-manage some of these, and it doesn't mean we don't need doctors and all, but there is this thing called yoga, hatha yoga practice that we can give to ourselves to help manage and bring some comfort and relief and release from some of those physical and mental anxieties.
Thank you. Thank you so much. Dr. Vaughn, you're next on deck. And in your role as a social worker, how do you see what we can do to prevent future suicides in the military?
Sure. I think for me, it's been a little bit of macro and micro. So when I look at it from my clinical lens, how do I help engage people to, one, maybe address the traumas that they're experiencing, if they're experiencing any. Also to provide coping skills, because I think a lot of our younger soldiers or soldiers in general have not had been equipped to manage stressors. We've been able to be trained how to do our jobs, but no one has trained us how to manage life and manage people and manage the other things that are compounded when we are just living our life, right? So from a clinical perspective, making sure that I am teaching people and helping people get through and overcome some of those struggles that they're experiencing, developing healthier coping skills, the way to manage problems, the way to look at their problems introspectively, get to the why. Why have you gotten here? How did you get here? What can we do to overcome it? It's not so bad, right? To advocate for, we can get through this. The next step is from a macro perspective. Since I am the clinical director, I'm trying to ensure, one, our access to care, which is horrendous right now, looks better. And how do I utilize my providers in a much more efficient way so that way we can provide evidence-based treatment? A lot of that means referring my soldiers back into the network. So I had to create standards of what is considered high risk versus low risk problems, not so much to put the message out that you're not important, but to utilize the team that I already have in the best way so that way we can provide evidence-based treatment without always working in crisis mode. Because I think a lot of mental health facilities are just putting Band-Aids over the wound versus actually addressing and treating the wound. And then also teaching my clinicians to terminate patients appropriately. We get so warm and fuzzy, and we see people get through traumas and crises, and we want to keep them all the way through to communicating poorly with their spouse. I got to have them discharge appropriately, after that 15 to 24 session, so we can bring the next crisis person and refer that person who is safe into the community. So creating a model that will create opportunities and avenues to treat as many people efficiently as possible is one of my roles as a social worker, from a clinical and from an organization, but also looking at how we're best utilizing our productivity and measuring outcomes. So if it would be all in vain if we were just being warm and fuzzy, giving everyone hugs and teaching them how to be great, but I also got to look at how the business is run to make sure that we are efficient and using our time in the most efficient way. That's the only way holistically I can really get beyond and prevent suicide, is to look at it from a very 360 perspective.
I see. Thanks a lot. Dr. Williams, are you aware of the biases? Well, actually, we know you are, toward medical treatment and procedures that specified for African-American women or African-Americans in general?
Well, of late, there have been significant biases in African-American women and African-American in general getting necessary healthcare and procedures that they really need. And hopefully that will change, but my sense is it's going to take a while, because society as a whole doesn't look on the African-American woman as they do women in general. That's kind of unfortunate. And this obviously leads into the Roe v. Wade situation, which has in my opinion, it's gonna cause a lot of unnecessary death and destruction, and force a lot of African-American women to try to go to the back alley clinics and the situation that existed many years ago. That's unfortunate, but I think also not only African-American women, people in general are going to start questioning what the Supreme Court really is going to do with things that have not yet been addressed, like same-sex marriage and stuff like that. So unfortunately, I think we entered a dark period with overturning Roe v. Wade, and hopefully that will change. But I'm not all that, I don't think positive about that anytime soon. So the country as a whole, I think, need a change in the significance of what really happened during the past 50 years, which people have been trying to reverse Roe v. Wade. From my opinion, a woman's body is a body. It should be the decision between her and her physician. And the final decision actually should be left up to her. And so I think that's where we are now, unfortunately.
I see. Thank you, Dr. Williams. Dr. Lee, I want to give props to Dr. Williams because he must be partially psychic, because I can ride on his answer straight to the question I have for you, which is, how does any negative news, we got climate problems, mass shootings, we got George Floyd's murder. This is before anybody else's time on the panel, but the Temptations had a song called Ball of Confusion. Oh. And for you youngsters, y'all have to go and look that up on YouTube. But Ball of Confusion, how does this affect today's African-American youth?
Well, yes, he was very pressing in his response in terms of the health care that is being changed, particularly for Black women. And that ties into everything else that you asked in your question. As a backdrop, I want to go back because in the opening, I didn't mention to everyone, I'm a developmental psychologist by training. I didn't mention that earlier, but I wanted to point that out. And then I also wanted to get back to the point about the identity. I didn't spell out completely the aspects of it, because that personal identity ties back into this question I'm going to answer that you're asking currently, is that our personal identity is tied into our social and cultural backgrounds. And as Jana Long had indicated about, instead of African American, but talking about as Black people and looking at our lineage much more broadly than just those of us being in America. We have to consider all of those factors when we're talking about identity, social media, mental health, and how those factors come together. So I wanted to tie that all back together to answer into this ideal of your current question that relates to the negative impacts of hearing all of this news, as I sort of touched on in my earlier response in regards to individuals hearing these things and experiencing these things. Psychologists tend to look at, there was one group of psychologists that conducted what they call a social rating scale. They created a social rating scale for individuals to look at how many instances of stress-related incidents occurred in their lives over a particular year. And we never really stop and think about that, right? You don't think about the day-to-day microaggressions against you in terms of discrimination or sexism or ageism or any of those factors that can be stressful for you. Losing a loved one, having a loss of a job, loss of a relationship, all of those compounding incidents of stress, living through the pandemic, coming out of the pandemic, going back into another pandemic with some other disease and financial, and all of those stressors, again, are compounding on top of one another. So when you look at these emerging health effects that occurs because of this, you're going to see it events into some of what Dr. Williams was just indicating in terms of the physiological states that we have. So now we have accelerated aging. So those of us in the Black or African American communities in particular experience these things because of the environments that most of us live in. When you look at living in the inner city environment versus a suburban environment, it causes more hypertension when you live in the inner city environment. All of the ambient noises that we typically don't tend to think about, right? The sirens that you hear running through the streets, the ambulance, the traffic, the loud noises that are late into the night. And then when you go into a suburban environment, it's quiet and serene and peaceful, which Jana, she's nodding to the fact that that has an impact then in terms of the yoga that she's talking about, in terms of keeping your system balanced and being able to maintain a homeostasis, basically. So when you look at a lot of these factors, hearing about the climate problems, the mass shootings, the George Williams incident, a lot of those factors cause us to age more quickly. And it's due to not only just hearing those horrific things that occur, but also due to the impact that we are experiencing directly. So we have a great deal of mental health and physiological health that are impacted by just hearing it in the news and then experiencing and living it. As I indicated earlier also, I think there's a higher level of anxiety within the younger generation than there ever has been seen in previous generations because of all of the social media alerts of these instances that they see. So they get to see a whole lot more than we did when we were growing up. And they have less resources, as I think Dr. Vaughn talked about as well, in being able to use those resources so that they can have a more effective outcomes. So we definitely need to look at how these stressors occur, because individuals who have a lot of stress are less likely to seek medical attention, either mental or physical medical attention. So it's definitely having a large impact on our community, and we're going to see the life expectancy rate drops drastically within the Black populations.
Thank you. I appreciate that. Sister Jana, I could be getting this wrong, but listening to you, does that mean if I start to take yoga, I'm going to want to run outside in the middle of a field and contemplate a pumpkin? What can I expect? What are some of the common misconceptions that impact yoga therapy and the African American community?
You're muted again.
Sure.
I was just going to say there's nothing wrong with running out and contemplating a pumpkin.
Okay.
In fact, doing something like that, right, might bring you to a place of calm. Our connection to nature is very important to our health. We are not separate entities in this environment. We are a part of it. And we're no more important in this environment than trees, birds, pumpkins, flowers, and anything else. That's part of the ego that we have developed that undermines our own health. It's our own egos that do this to us. One of the things that yoga teaches us, it's about the self. Everything in yoga goes towards the self, the idea or the goal of self-reflection, self-acceptance, self-love, self-introspection and insight. That is if there's any goal to yoga, it's for you to know who you are. That is the ultimate goal of the practice, and to understand who you are in relationship to this garden that we were put in, called Earth. So this is a good practice to go contemplate pumpkins. However, what I will say, one of the things that our society, this society is what is called rajasic in yoga. Rajas means active, moving all the time. In fact, when we're not moving, we feel guilty, like I should be doing something. You will never see your self-reflection as long as you are moving. And one of the ways this is explained in yoga is, for example, if you were before a body of water and the water is moving, there's lots of waves and tides rolling in and out. That's the movement of the water. However, if you approach a body of water and it is still, when you look into that water, you can see your own reflection. You will never see your reflection in moving water. And that's the same with the movement of your mind, our constant chatter and chitter. And in fact, the word for that constant chatter of the mind, you know what it's called? Chit, C-H-I-T. And that might be how we derived another word, right? And we have a term that we call, and I'll just substitute the yoga word, chit for brains. You heard that one before? Yoga teaches us to calm that. In fact, the definition of yoga is stilling the fluctuations of the mind. That's what the definition of yoga is. In the language of Sanskrit, it is chitta vritti nirodha. Yoga is stilling the fluctuations of the mind, because it is those fluctuations of the mind that create your anxiety, your insecurity, arouse your fears, etc. So until you learn to look at that and see that, and contemplating a pumpkin can help you do that, brings your mind to one focus, one pointed focus. I am one with the pumpkin. And maybe by seeing the pumpkin, I can see something in myself. That's yoga. And we need more of that, because our minds are moving in ways that we don't even understand. And we're bombarded with so many messages now. Our generation, I'm 70. And there was a time when I didn't have as much bombardment of information. I wasn't on Facebook and all this stuff. TV went off at midnight, and some of the radio stations did too. There was time to sit and reflect. And and people acted more civilized, but the more we are bombarded with all of this messaging and feeling that we've got to be doing something all the time, we never are given an opportunity to look at, is that even useful? Is it serving me? What are my values? And see, yoga makes you think about those things when you come to yourself. And that's why I teach yoga, because helping people to come back to self, because that's all you got. That's all you got, really. So, yeah.
Thank you. Thank you so much. Listen, you give me a whole new perspective. The next time my older cousin in New York calls me Pumpkinhead, I got something for him now. I got some stuff to come back with him. So thank you very much. Thank you. I definitely appreciate it. Dr. Vaughn, I'm going to take you from the middle of my pumpkin field to how can we help normalize therapy in the military and in our larger African-American community?
Let it be okay. Sometimes we make a big deal out of things that, one, is none of our business. And then two, because we think it has some sort of shame to it. So I won't ignore the fact that we have lots of undiagnosed stuff in our culture.
Mhm.
And the moment you put a name to it, creates some sort of default, like we have some sort of defect, or our family has created this defect, versus looking at it as how can we overcome it? You know, when we do sometimes when I do history taking and I ask people, is there people in your family who have been suspicious or a suspicion of mental health, but no one has ever gotten treated, right? We always had that crazy aunt, the crazy uncle, the person that goes on a rant, or the person that just always has these dramas going on. Talk to me about that person in your family. So that way, maybe if it's connected, we can help get to the why, right? And just, I think the church also, we have such a strong history in the Black culture where the church was part of our mental health. It was part of our medical community. It was part of our political community. And I definitely understand the separation of, you know, church and state, but we have a history that's rooted in being a community and connectiveness that help people overcome. And we've trailed away significantly from that. But also holding, if I'm going to bring the church in, holding our spiritual leaders accountable to be credentialed to do the right thing. If it's out of your wheelhouse, get it to the wheelhouse so that way we can treat people appropriately versus very ignorant and that will put people at harm. So having a cultural change of how we get help and what that looks like, and also a little bit just let people do what they need to do to take care of themselves and make it okay. Give people permission to be okay, which is why I'm also kind of on the fence of, you know, those tele-behavioral health type systems. But the one thing I love about their advertisement is that they normalize it, right? Like they try to tell you just to get a Snicker bar, and the other person's like, a Snicker's not going to treat this depression and the crying and the bullying, right? And it's that aha moment that, yes, there's something more going on that a Snicker bar can't cover. So let me seek someone that may be able to get me through this and get me over the hump. And it's okay. Like, it's just okay. I think our younger generation has definitely, via social media and TikTok and YouTube, put an okay. They're using words such as I'm depressed. They're using such words, maybe inappropriately, they're narcissistic, but it's okay. I'd rather someone inappropriately have a bad definition and I fix the definition in-house than for them never to come into the office because someone has given them a name or classified them. That opens the door to having more conversations when we have normalized that it's okay, you're struggling a little bit, let's go get help. And not wait. The last thing is also giving access to people. Mental health is not part of most of our insurance plans. So we're paying out of pocket and it's expensive. For those who need inpatient stay, it is expensive to do a 30-day stay to get the appropriate treatment you need for sexual trauma or PTSD. So normalizing that this cost should not be tremendous for people to have access to, and that if it is part of their insurance plan, let's utilize it and use the option that you have. And then also reaching the despair community that won't have options via their insurance and figuring out a way to get them the help that they need. I think that's the best way we can overcome what behavioral health is. I think our service members in general, when they come in, don't think about mental health because it was never an option in their lives prior to coming into the military. So if you're taught to take ginger ale and eat soda crackers when you're sick and upset, then you're going to keep drinking ginger ale and soda crackers. You're not going to think about, let me go. And I think that's an eye opener for everybody. I hurt myself. So there's a doctor that will actually help take care of this wound. It's the same way in behavioral health. You may not have experienced that, but once the door is open, that is there, allow people to use that door and let them enter in.
Thank you. Wow. Thank you very much.
I
Appreciate
second
it.
everything she just said. I'm a professor also, by the way. I didn't mention that either. I don't know what my brain is, but and I say exactly what you just said to my students every class, and regardless of what the topic of the class is, at the end of the day, if you have a stomach ache or toothache, you go see someone for it. If there's a difficulty in your life, something that's overwhelming for you, go see someone who can help you with it so that you may overcome it, so that it won't be a something that someone is talking about. But we have so much pride in ourselves And I also touch on all of those points that you mentioned in terms of our community, you know, the church, and the stigmatism that we have against mental health. It's a weakness. And so there's just so much that you just mentioned there, Dr. Vaughn, that's right on target to everything I think needs to be spoken of more across all platforms, realistically. Thank you for sharing.
Oh, absolutely. Thank you.
Dr. Williams, what are the repercussions of Roe v. Wade and, particularly for Black women and the larger African-American community as well?
Well, Roe v. Wade, unfortunately, has, in my opinion, set us back decades. And for Black women, it is really horrendous, because now a lot of Black women not able to go and have abortion, pay for it. Some states absolutely refusing to allow Black women to do that. So I see, unfortunately, more death as a result of them overturning it, because a lot of Black women are going to go to situations that are really not recommended for medical care. And of course, now you also have a lot of physicians who have been so affected by it that they are refusing to do it, even though the mother's life is at stake. That's unfortunate too, because the repercussions that a lot of physicians, especially Black physicians, feel that they will have to go to, unfortunately, as it is severely adversely affected the overall health of Black and women in general, which is why I think now we are seeing the uprising of women, not only Black women, but women in general, who are saying, look, this is wrong. It should never have happened. We are responsible for our own bodies. And as physicians, we have to respect that. We were trained to respect their decisions and all patient decisions. I mean, I have not ever done an abortion. We were trained to do them, but in my perspective, I'm thinking it should be the decision that the woman makes because it's her body. And therefore, to me, she should be the only one making the final decision as to whether or not she's going to have this procedure or not. And so it is devastating, unfortunately, but it has happened. And so for the time being, I think, we have to live with it.
Thank you, Dr. Williams. Sister Jana, what types of solutions do you typically offer your clientele to focus on strengthening overall health and wellness?
Forgot or remembered to do it this time. Okay, so one of the things, let me set it up this way. As a yoga teacher, yoga therapist, one thing I always say to people coming into the practice, yoga is simple, but it is not necessarily easy. It is simple, but it is not necessarily easy. One of the parts of it that is not easy is establishing practice. Practice, so what I share with them is a practice is anything that you do repeatedly, day in and day out. The thing that you need to look at is, are you practicing consciously or unconsciously? So it causes us, we need to take the time by sitting still and in quiet. You would be surprised at how many people, adult people, I expect this from children But you would be surprised at how many adults cannot sit still in quiet and be quiet for just 3 minutes. That's a practice. That's a yoga practice. So one of the first things that I suggest, sit still, in quiet, be quiet for 3 minutes a day. See if you can do that. There was a yoga teacher that came from India, Swami Kripalu, for whom the largest yoga retreat center in the United States is named. Swami Kripalu said, a little bit of yoga goes a long way, but you have to do it. Not think about it, not talk about it with your friends. You must do it. And a little bit. So that 3-minute sit in quiet, still, your body still, and you are quiet for 3 minutes a day. The other thing, in terms of opening up your body, one of the practices, a physical practice I give people to begin takes 3 minutes. Will you do it? It's moving your spine in every way you can move it. Stretching up, which you do when you get up in the morning, bending forward and letting your upper torso weigh and stretch into the back of your body, coming back up, bending to the right, bending to the left, and then taking your body back into a back bend. They call that 5 movements of the spine. It takes 3 minutes. Will you do it though? So it's establishing the practice. It's not the duration of the practice that counts. It is that you do something all the time. And you have to look at it. You brush your teeth. If you are in the habit of brushing your teeth every day, you don't think about it. You just go do it. You don't think about a lot of things you do, like when somebody cuts you off in traffic and you're ready to flip the middle finger at them. That's a habitual pattern of behavior. You ever look at that? Because the reason I say looking at our habitual patterns, which you have to be still and quiet to do that, will help us disrupt some of the behaviors that we have developed that don't serve us any longer. But you have to be able to see it before you can change it. And that's what yoga helps us to do, again, to see ourselves so that we can begin to notice when we are, here's the word, a new word that everybody's using, triggered by, the trigger is not outside of you. The trigger's in you. Why are you triggered? Do you ever look at that? What is it? And some of these things, let me just say, go way, way, way back for us. They may have been formed when we were children, when we didn't have the vocabulary to articulate what we were feeling. We simply responded and reacted, and we continue to respond and react in the same way over and over again. Now you're a full-grown adult, you still respond like you did when you were 8, 9, 10 years old. You have to look at it. You have to be with yourself. And that's something that many of us fear. And the pandemic shed light on that. The number of people who went crazy because they couldn't go anywhere. They were with themselves essentially, or with their families, and it drove them nuts. You've got to be able to come home to self. And yoga helps us to do that. And once we begin to delve more deeply into our own inner workings, and then there are tenets of yoga, before we even get to that, what we call yoga in America, that physical practice that you see people doing on the yoga mat. That's the third limb. There are 2 more limbs before that. The first one is, who are you in the society that you live in? What kind of person are you? And that has 5 limbs. Are you harming people with your actions and your words? Do you steal stuff that don't belong to you? Do you tell the truth? Do you have any restraint, or do you just go for something because your desire has come up? Do you hoard stuff? Are you stingy? Or, these are the first 5. And then there are the personal observances. Are you clean? Do you know how to cultivate contentment? Do you have any discipline? Do you study yourself and other things? And what's your connection to the greater, whether we call it God or whatever? What do you have a connection? Then you come to your yoga mat. That's when after you've sort of worked through all of that. So as I was saying, it's a big system that mainly because the physical aspect of yoga can be commercialized and commodified, which seems to be what we have to do with everything in this culture. We got to figure out how to make some money off of it. And, and as a result, you got all this crazy stuff, dog yoga, wine and yoga, cannabis yoga, et cetera, et cetera. But as I said, the essence of the practice, yoga is a mental practice with a physical component. And it is there, it is here. It's ancient teachings and codification dating back 5,000 years. It's a healing practice. And let me just add this. It is hard to unravel the Vedic roots of yoga from its Hindu cosmology. I understand why that trips people up, but just understand these healing practices were available across many different cultures. It's just that this particular one was written down. It was not oral tradition. They wrote it, it was codified in writing and shared with us to use. It has a universality to it. So I just, I would tell people to take some time, sit still, in quiet, be quiet, and see what arises within you.
Thank you, Sister Jana. There is one discipline that I must have, and that's because it's almost time for us to go. If anyone has a last very quick comment they want to share, please do so. But the clock on the clubhouse wall is telling me that it's time to wrap it up. And but I think the boss will allow us another couple seconds if you want to quickly share a pearl of wisdom with us before we go. And if not, yeah, Dr. Lee, yes, sir.
I would ask about the significance of the humming in yoga.
Mm-hmm. Oh,
you're on mute, Jana.
You're referring to chanting in yoga when you say humming?
Right.
Put it this way, it's the same thing as singing in church, that when we come together collectively in community and we share something from the essence of ourselves, be that chanting, singing in unison, dancing, all of these are expressions of spirit. They're all expressions of spirit that help to bind a community together. And that's why chanting is done in yoga.
Okay.
Dr. Lee, did you have something? I saw you unmute.
Yeah.
Well, no, I had unmuted just to be able to say goodbye for parting greetings. But I do want to say, though, that listening to Dr. Williams as well as Jana's statements, there are themes that I talk about and discuss in developmental psychology, in particular, in that ideal of slowing down and letting your spirit catch up with your body is one thing that I often talk a lot about, because that's something that we see as part of that longevity of life, being able to let your spirit dwell within your body and calming your body down for just a moment. Then I also wanted to speak to the point about what Dr. Williams was mentioning in terms of the Roe versus Wade issue and the ideal of, the rights of the woman and conception and birthing. a very beautiful sacrifice that women make for us. And I think that's a choice that they should have solely in being able to decide upon. So I talk heavily about that as well to enlighten individuals, because, I believe that you need to share as much information as possible with all segments that you come in contact with, so they may be enlightened into some understanding of how to comport themselves moving forward. And I teach a variety of people, different ages, younger people, as well as some middle-aged people who did not learn certain lessons as well.
All right. Back in June, my final comment, back in June, the Virginia State Health Commissioner, Dr. Colin Green, dismissed the impact of structural racism on Black health. And he particularly singled out Black women, mothers of color, and their babies. And he further suggested that we need to stop talking about racism insofar as it connects to health, because it quote unquote alienates white people. I do not, it's not about, I don't agree, but it is the fact that it points toward a troublesome road that Black health professionals are going to have to travel.
Yep.
And we need to prepare for that. And I think one of the ways we can do that is to continue to have discussions such as we've had here today, where we can share perspective across a fields of endeavor. I want to thank the crew and Sister Cheryl and Dr. Alicia and Lisa and all of you today, as I turn it back over to the inimitable Dr. Alicia Williams. Thank you all.
Thank you. Thank you so much, CR. And thank you, Dr. Clemmy Williams, Dr. Janet Vaughn, Dr. Mark Lee, and Jana Long. It has been a pleasure to hear your voices today. I'm going to hand it off to Lisa, one of our co-producers, who will wrap up today's conversation.
Thank you so much to all of our panelists for sharing your insight on such a complex topic. And what I learned today, how important it is to put ourselves first, but sometimes we realize we need to ask help, whether it's our family physician, psychologist, if, reach out to our community or church and really take care of ourselves. I think that that's very important. And it was very enlightening to hear everything from the pumpkin to how people have dealt with or not dealt with the pandemic. Thank you so much, everybody, for sharing your thoughts, and have a wonderful day.
Thank you all. Take care.
Take care, everyone.
Thank you. Bye-bye.
Bye-bye.
Bye now.
Hi, thank you.
Thank you, Jana.